Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates. This little baby that you see on your screen is only 18 days old and is battling COVID. We are at this point inside the COVID ICU of the SRCC Children's Hospital run by Narayana Health. I have here with me Dr. Soonu Udani, who's going to be talking about one of the big untold stories of this pandemic, the main difference between 2020 and 2021. And it's not good news. Younger children, infants, literally toddlers are getting infected. Doctor, tell us a little bit about the baby we just saw first, 18 days old and battling COVID.
So this baby came to us at the age of 15 days, actually came from out of Bombay and obviously traveled quite a distance to come here. What we have in this baby is a very, very severe pneumonia. And also because of the pressures that have been required to keep her oxygenation going, we've actually had to put tubes because she had a burst lung. And unfortunately, she is really fighting for her life. Now, COVID is not known to go from mother to baby through the placenta like we have HIV or other diseases. But we do know that horizontal transmission, which means from family members or a mother herself, or maybe even from a hospital environment, they do get infected from that.
And you're saying that this little child, this newborn, 18 days old, is critically ill?
She is critically ill.
And literally fighting for her life?
Absolutely. This ventilator that you see is a very special ventilator.
This one, can you tell us a little bit about it?
It's, like you see, this is not normal in and out air. This is called high frequency oscillation. And it just wiggles the child. And it's a different method of ventilating. And the very fact that you see this child on this ventilator means that her lungs are really, really bad.
And I could see the baby's hand and the baby's chest actually trembling, that tremor. Is that tremor the lungs, or is it from actually the ventilator?
It's from the machine.
It's from the machine.
It's from the machine. This is called high frequency oscillation. So the oscillations cause the wiggle that you're seeing and the tremor. It's not coming from the child.
Well, it's just a heartbreaking moment, Doctor, as we walk through this ward, to consider the fact that there's an 18-day child who's battling for her. It's a girl?
It's a girl, yeah.
For her life. And, what I want you to talk about a little bit is what's actually going on in the ward right now in terms of what you're seeing as the difference between last year and this year in how children are getting impacted. And obviously, we're not going to identify any child who does not want to be identified. But, just from their little hands and their little feet, we can actually see what we're dealing with here.
So this year, we are seeing a big difference from what we saw last year. Last year, as soon as the pandemic started, we put in our protocols, we put in our requisite drugs and everything. And we segregated the wards. And what we actually found was that we had wasted capacity because children did not require admission. Even if they did, they were very mild, and we really did not have to worry about them too much. Most of them we treated at home. This year, we are finding that almost every child who comes with a fever or anything tests positive. We are still treating many of them at home. We have a brochure that tells parents how to manage, and all those who actually get admitted are quite sick.
So you're saying that more children need hospitalization this year. It's hitting children harder, and the ones who come in more seriously ill than before.
For example, last year we had only one child out of 120 that had a bad pneumonia. This year, since 1 month, we've already have 4 or 5 with very severe pneumonias. You can see there's a ventilated boy out there, and we are in trouble this year. And this year we don't have any wasted capacity. We are now, 100% capacity full.
And how many children are here in this in this COVID wing of the hospital?
About 14 children right now.
So 14 children requiring hospitalization, and I can here, of course, see a trolley of medicines, of odds and ends. But basically, what I want to ask you is, how many children are at this point requiring a ventilator?
2 are actually on a ventilator, and there are some on oxygen.
And If you had to say in one sentence, what are you seeing in terms of children's capacity to fight this? Because what we did know last year was that children transmitted often asymptomatically and did not know even that they had COVID. This year, are you seeing many more symptomatic young children? And what is the average age group of the children that are coming in? I mean, we saw the 18-day child, but what is the average age of the children you're seeing getting COVID?
We are seeing the entire gamut. Like you saw this little baby who's a newborn. We have a 15-year-old as well. So all age groups are getting sick. I can't particularly tell you because it's been a short time and the numbers would not be statistically significant, but we are seeing older children, like in their 8, 9 years. Another thing we have noticed, and it just may be an observation currently, is that the ones who are a little on the obese side, they are getting more severely ill. So just like in adults where obesity is a risk factor, seems to be that way in children too.
And what is the line of treatment? I mean, I can see here, I'm assuming this is for pumping? Is this?
No, this is a defibrillator.
Okay, can you talk a little bit about this machine?
A defibrillator would be very rarely needed. It is only when the rhythm of the heart goes wrong that we use it. So every ward has a defibrillator. That's a standard of care. But we don't anticipate that we would need to use it a lot.
And I'm seeing here, of course, the oxygen cylinder, and high-flow oxygen remains a key part of COVID treatment. What's disturbing for me to hear is that you're saying that the pneumonia in the kids is much more serious this year. How often are you having to use oxygen?
Many of them have been on oxygen when they first came. Now some of them are off oxygen. I would say about 60% have required oxygen.
If we'll just walk a little bit this way, what is the line of treatment that you're using with kids? Is it different from how you're treating adults?
No, we are using remdesivir in children as well. We are using steroids, but we are not using doxycycline, ivermectin or any of those unproven therapies, but we do use remdesivir and steroids.
And remdesivir is running short everywhere. How are you doing on that?
Hopefully our stocks will last. We don't have a very large stock, but currently we do. Children also take smaller doses, so that helps us divide up the...
Now, COVID is typically an isolation illness, and with adults, of course, you have people who have to, patients remain alone. You can't do that with children. I'm actually seeing parents here in the ICU with their kids, which totally makes sense. Talk a little bit about that. How kids have to be handled differently. You can't follow the same protocol.
Absolutely. We cannot have children sit without parents. It would be very, very traumatic. And whether they have COVID or any other illness, our practice is to allow parents with their children. We may ask them to just step outside if we are making rounds or doing a major procedure or have a catastrophe, but parents need to stay with their children. Many of these parents themselves are COVID positive and asymptomatic, but if they are not, then we give them the choice that do you want to stay with your child with masking, or do you want someone else in the family to stay? But we do give them that choice.
What is the biggest challenge that you're facing, doctor?
Manpower.
Okay, talk a little bit about that.
Because manpower, the nurses do 12-hour shifts.
In these PPEs in which you cannot breathe.
They get 2 breaks in those 12-hour shifts.
Yeah.
And it's difficult. Just to put it very practically, if you even want to go to the toilet, it's not easy. You have to think 10 times, I have to remove it, I have to don, doff. So that is a major problem. And the other thing about that is that we, have this practice of keeping them on duties for 15 days and then giving them 5 to 6 days isolation and a little break. Because of that break, you have 14 nurses on shifts who are taking a break. It becomes a manpower crunch.
What is this going to do to the debate around opening schools for kids?
I would not advise it at all. I would not.
For how long? We just don't know.
That I don't know. Normally, what the epidemiologists say is when the incidence falls below 5% of all tested cases, then you can open up schools.
What are you seeing right now, just anecdotally?
I think it's very high. It's probably over 10%. When it started, it was 10%. So I think it must be much higher now.
So 10% of all kids who come in here to be tested are turning out to be positive?
Currently more than that. But
roughly how many?
Almost. almost 80% right now. But we can't take that as an epidemiological figure because we get a cohort.
They referred and they come to the children's
because
hospital.
They're sick, they come. This is not a general population.
So you would not advise the opening of schools, which brings us to the fact that we really need to start vaccinating children. We can't keep thinking of just vaccines for the older population.
I would completely agree with that because we've seen that all vaccines, the trials are always done in adults, then the same trials are repeated in children and the same vaccine is given to children. I don't see why a vaccine that can be given to a 20-year-old or an 18-year-old, as the current guideline is, can't be given to a 12 or 13-year-old.
You're saying the vaccine would be safe for kids?
I believe that it should be very safe for kids as well. And the faster they make some kind of decision on that, the faster they fast-track these trials, I think would be a major impact on the COVID incidence in children.
How do you keep parents calm and how do you keep yourself calm when it involves babies?
So keeping ourselves calm is not a major thing. We've been doing this for years. Parents are very anxious when they first come in. And I'm sure many of them will tell you that. But once they see that their child is getting better, that we know how to actually look after the baby, I think they are. And I think most of them, if you look around, they look all right.
They look quite calm, but that doesn't take away from the fact that the virus is hitting more children and more severely than last year.
Absolutely. And it doesn't take away from the fact that there is a high level of anxiety in parents. But coming to the second part of COVID in children, we are very vigilant about post-COVID multi-inflammatory syndrome.
Can you talk about the long COVID on children? I haven't heard much about that.
So I don't know too much about the psychiatric effects or the fatigue and what they call COVID fog in children, but I do know that 7 to 15 days after an infection, a significant number come down with what is called multi-inflammatory syndrome. There they have a high fever, they get a rash, they get red eyes, and their heart is often affected. We had a child who was just discharged 2 days ago who had a severe infection of the heart from this. So COVID is affecting all organs. We've had a kid who came in with convulsions just now. It's affecting everything. The other difference we are seeing, I should mention that, is the spectrum. Last time they were pretty asymptomatic, a little cough and cold, like a flu. This time, the spectrum includes a lot of drowsiness, stupor, what we call encephalopathy, and a lot of diarrhea, dehydration. And many of them are actually coming in shock.
This is so sobering to be here. Doctor, thank you for your time. I again want to remind our audience that we are in the SRCC Children's Hospital where the doctor has just explained to us how COVID is hitting many, many more children than before in a more severe way. And I want to end again with the little baby behind me, an 18-day-old child, that you can see in the distance on a ventilator, literally fighting for her life. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.